Bismillahir Rahmanir Rahim. Now, I was talking about the basic dermatological terminologies and lesions. It's session 2. I'm Professor Syed Ali Haider. I am an honorary global professor of medicine without any name or any fame or any economics. So, previously I was talking about the importance of dermatology. So, terminologies are important to understand, and type of the lesions which are produced by a disease process should be clearly understood. These terminologies are very important, very important. So, it is session 2. After taking the history of the patient, everything has been fulfilled. The description is there, the duration of the lesions, and then which part of the body is involved, specific parts, or it is the whole of the body is involved, whether the mucous membranes are involved or not. And then describing the morphology, whether it is a macular lesion, papular lesion, bullous, or whatever it is. And third important thing is whether they are macules, if they are present, or papules, where they are in one line, or they are asymmetrical, they are on one side of the body or both sides of the body, etc. And then we go for the other things as well, and you see that the configuration of the lesion means that the shape or outline of the skin lesion. Now, skin lesions are often grouped. They are grouped together in one part of the body. The pattern or the shape may help in the diagnosis, as many skin conditions have characteristic configuration, very characteristic, like psoriasis, for example. Numeral lesion, they are round shaped or coin shaped lesions, also known as discoid. Discoid means point, one side, it is concave, and other side is convex, or both convex or both convex. And linear lesion, a linear shape to a lesion often occurs from some external reasons such as scratching, or also known as striae. And target lesions, they are concentric rings like dartboard, also known as iris type of a lesion. Gyrate lesion, a rash that appears to be whirl in appearance, in a circle, whirl in circle. Annular lesions grouped in circle, annular, round shape. Now this is the linear lesion. I see in front of this is annular lesion. This is linear, this is annular, this is numeral type of a lesion you see here. And target lesions are this. And gyrate lesions, a whirl appearance. This is a whirl appearance. There is, of course, you see there are certain about the scales are concerned, they are shiny scales. These are, again, this type of the lesion is a linear here. This is, of course, a numeral lesion. Numeral, it is a big one. You see, this is a numeral. They are rounded shape, but a big lesion. They are coinciding each other. The color should be described. Descriptive terms used to describe the skin color include the keratoderma, yellow orange skin hue due to the excessive circulating beta carotene, carotenemia, that is called. Vitamin A precursor derived from the yellow orange colored vegetables like radish, like these type of things. Carrots, and the fruit tends to be pronounced on the palms and the soles and does not affect the sclera. So there is a yellow discoloration of the hands, soles, palms, but these yellow discoloration would not appear in the sclera. This is very important to distinguish from the jaundice is concerned. And hyperpigmentation, dark skin compared dark skin compared to the normal, it can be localized or generalized. Hyperpigmentation. Hypopigmentation skin color that is paler than normal. Leukoderma are the absolutely white skin, also known as acromiae. Infarcts are the black areas of the necrotic tissues due to the interrupted blood supply. Jaundice, yellow discoloration of the skin and whites of the sclera, eye, and due to the buildup of the bile pigments in the blood. Hyperbilirubinemia, that is usually due to the biliary or the liver disease. Erythema, red skin due to increased blood supply, may be applied to any red-colored dermatosis. Another condition is the severity of the erythroderma. The skin condition affects the whole body, nearly the whole body. It is red all over. It is emergency, dermatological emergency. Telangiectasias, prominent cutaneous blood vessels that are red or purple, as you see in the diagrams here. The different hyperpigmentations are seen. The keratogenemia. On this, you see hyperpigmentation. Hyperpigmentation is chloasma. Keratogenemia on the hands, hyperpigmentation are seen here. It may be possibility of fungal infection, bacteria, vesicular, or other condition as well. This is definitely jaundice. You see the yellow discoloration and the leukoderma. Leukoderma are the big one, the absolute white acromia. And you find the erythema, reddish. There are many conditions, cellulitis, another condition as well, in SLE also, the malar flush. And the erythroderma is the whole of the skin is involved, whole body skin. It is a medical emergency. Telangiectasias, the coagulation, prominent cutaneous blood vessels, they are red or purple. The morphology should be described in the form of the structure of individual skin lesion. Skin lesion may be flat, elevated above the plane of the skin, or depressed below the plane of the skin. They may be skin colored or red, pink, bluish, brown, black, grey, blue, orange, yellow. You should describe. Consistency may be soft if you want to palpate it. Is firm or hard or fluctuant, or maybe sclerosed, scarred, or the board-like. The lesion may be hotter or cooler than the surrounding skin. It is Lewis response. There may be mobile type of a lesion or immobile lesion. Macular lesion, a small patch of skin that is altered in color but is not elevated. A patch, a large area of the color change with a smooth surface. The patch is a colored patch. The pupil, you find the elevated solid palpable lesion that is less than 1 centimeter diameter. They may be solitary or multiple. Pupils may be equivalent pointed, dome-shaped, rounded, filiform, thread-like. It may be flat-topped, oval or round. It may be pedunculated with a stalk, sessile without a stalk, umbilicated with a central depression, and varicose-like, warted in appearance. There are different type of morphologies are there. So the pupil or plaque then afterwards, the circumscribed palpable lesion that is more than 1 centimeter diameter. Most plaques are elevated. Plaques may result from the coalescence of pupules. Most plaques are elevated actually, but a plaque can also be thickened area without being visibly raised above the skin surface. They may have well-defined or ill-defined borders. The name plaque is derived from the French word for a plate. Plaque may be annular, it may be ring-shaped. Arcuate, half-moon shaped. It may be polygonal plaque, varied non-geometrical shape. Polymorphic, varied shape. It may be serpentinous in the shape of like a snake, and poikilodermatous type of a plaque that is variegated appearance, usually mixed pallor, telangiectasia, and pigmentation. As you see here, the lesions are describing here the arcuate, the half-moon shape, and polymorphic, different type of the shapes. And serpentinous, this is the serpentinous type, and the poikilodermatous variegated type of appearance. Variegated, different type of the lesions is there. Possibility of this. So it may be polygonal, it may be polymorphic, varied shapes. it may be serpinges like a snail-like, or palodermatosis, variegate appearance with a mixed pallor, telangiectasia, etc. As you see here, also, this is seen here in a different, in one lesion, all things are present. Appearance are variegated, and mixed pallor, telangiectasia, and pigmentation are seen. So these are the types, or the morphological types of the plaques. So vesicle, you know what is the vesicle, and the pustule, and the bulla, and the abscess. It is a localized collection of pus. It may be wheal, also spelt wheal. It is the elevation of the skin due to dermal edema, often paler, with central erythematous rim, and without surface change. Whealing indicates urticaria. There are sign crown, or what is called the urticaria, or an urticaria-like condition, other allergic conditions. Skin surface should be described. What is the condition of the skin on the lesion? It may be scaling or hyperkeratosis, possibly an increase in the dead cell on the surface of the skin, stratum corneum, descriptive terms for the scaling is concerned. Scale is concerned. Desquamation, skin coming up in the scales, sororiform, large white or the silver flakes. It may be pitreous-form, the briny powdered scale, and it may be lichenoid. The apparent scale is tightly adherent to the skin surface. It may be keratotic, like horny scale, just like horn. Exfoliation, like peeling of the skin, and maceration, moist peeling skin, and viscous, warty in appearance. The scales are described, or hyperkeratosis described, in this fashion. As the diagrams, see the pictures are seen, reduced commission, sororiform type of lesions, and it is the pitreous-form, that is the briny powder type of a scale, lichenoid type of the scales, keratotic, horny skin, just like this, and this is the keratotic, and the exfoliation type. It may be a maceration, macerated skin is peeled off here in this fashion, and it may be viscous and warty-like appearance of the scale is concerned. So scale should be described, or hyperkeratosis should be described in this fashion. Secondary changes are lichenification, caused by the chronic rubbing, the palpable thickened skin. This common one is very commonly seen in chronic atopic eczema and lichen simplex. Crusting, the result of the plasma exuding through an eroded epidermis. It is rough on the surface and is yellow or brown in color. Bloody crust appears red, purple, or black. Dystrophy means that the degeneration or abnormal formation of the skin. It is often used to refer to the nails, dystrophic nails or terminology. Excoriation is the loss of the epidermis and the portion of the dermis due to the scratching or exogenous injury, like for example acid is poured out on the skin. It may be linear or punctate. Erosion or sore due to the superficial or partial destruction of surface tissue such as skin, and fissure means that split, crack, erosion or narrow ulceration of the skin. Pingating refers to the large malignant tumor that is erupting like a mushroom or fungus-like. And granulation tissue made of the mass of the new capillaries and fibrous tissue in healing wound. Ulcer is the full thickness loss of the epidermis plus at least a portion of the dermis. It may extend into the subcutaneous tissue, and ulcer heals with a scar. It is shown here. Lichenification, crusting, dystrophic nails, see in cases of, for example, psoriasis, and excoriation are seen here, and the erosions, fissure, pungating, and granulation tissues oozing out here, and ulcer is formed. These are the secondary changes in the lesion. If they are present, they are not primary changes, they are secondary changes. So all descriptive terms I have told you. You are taking a dermatological condition, whether it is due to the primary dermatological problem, or it is due to the manifestation of systemic disease, should be described like this, so that a disease may be diagnosed because of the peripheral stigmata of the systemic disease, or disease may be diagnosed as a primary disorder of the skin. If you describe like this, you can diagnose it. Although the differential diagnosis must be done because the same lesion appears in the other type of a disease also. So it depends upon the experiencing to see the lesion. So this is the presentation of the part 2. I hope that you have enjoyed it, I think, and I hope that you will also try to remember it. If there is any question, you can put it, because I am not a dermatologist, I am internal medicine. I will try to answer it. وما علينا إلا البلاغ.